Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the whooping cough, diagnosis and treatment. Whooping cough is a common, highly contagious disease common in infants, children between the ages of 6 to 12 years. It is characterized by spasmodic or paroxysmal cough ending in a whoop sound. Occasionally end with vomiting. It is caused by Bordetella pertussis. It is endemic worldwide. Sometimes may be followed by gastroenteritis. Transmission. It spreads by droplet infection from the active cases, especially during catarrhal and paroxysmal stages. Clinical features. The incubation period is 7 to 14 days. The disease runs for about 6 weeks and is divided into 3 stages, each lasting for 2 weeks. Catarrhal stage starts insidiously, lasts for 2 weeks. Symptoms are cold, fever, anorexia and restlessness. Hacking cough starts with night bouts in the beginning and become diurnal. It is followed by paroxysmal cough and vomiting, alerting the physician. Paroxysmal stage. Cough becomes aggressive with rapidly successive bouts of cough followed by deep inspiration which causes a sound whoop. The cough is triggered by crying, feeding and excitement. Convalescent stage. The symptoms regress, cough becomes less intense, vomiting ceases and slowly become healthy. Diagnosis. The characteristic whoop is the primary diagnostic point. Total WBC count, it is low in the starting but increases sometimes as high as 80,000. Differential count. There is increase of lymphocytes up to 90%. There may be moderate rise of eosinophils during convalescence. ESR. It is very characteristic and as low as 1 mm per hour. X-ray. Patchy atelectasis even in mild cases. Emphysema, pneumothorax or flare-up of primary tuberculosis may be seen. Bacteriological diagnosis. Caused organism may be isolated by cough plate technique or nasopharyngeal swab. The organism may be obtained in catarrhal stage. Culture and sensitivity. By supralaryngeal swab or thick mucus from nostril after cough may be good material to have organisms to grow in the culture. Borden-Genow medium or Nicholson and Turner's medium may be used for culture. Fluorescent antibody technique affords considerable help in diagnosis. Serum antibodies test may not be much of help. Differential diagnosis. It is to be differentiated from acute leukemia, foreign body in the respiratory tract, progressive primary tuberculosis, influenza, adenoviral infection and cystic fibrosis of the pancreas. Complications. Respiratory. Atelectasis and emphysema, pneumothorax, pneumomediastinum and surgical emphysema, bronchitis and bronchopneumonia, hemoptysis, bronchiectasis and otitis media. Nervous system. Convulsions due to anoxia, hemorrhage or due to tetany, encephalitis, transient paraplegia, and monoplegia. Other complications: puffy face, subconjunctival hemorrhage, prolapse of rectum, hernia, etc. Treatment: symptomatic treatment. Adequate nutrition, frequent small feeds are given every 30 minutes to prevent vomiting. Midrindon 10 minutes before feeding may prevent vomiting. Proper hydration is important. If complicated, hospitalization is important. Suction of oropharyngeal secretions is important and life-saving. Sedatives: antispasmodic cough mixture are of value to control nighttime cough. Cough suppressants containing CPM may be helpful. Secondary infections are controlled with appropriate antibiotics. Specific treatment: tetracycline 20 milligrams per kg per day or chloramphenicol 20 to 100 milligrams per kg per day are used with good results. The drugs are used for 7 days if oral therapy is not possible. Parenteral route is used. Gamma globulin 3 to 6 units may be beneficial. Isoniazid is beneficial. Prevention: passive immunization using hyperimmune gamma globulin IM soon after exposure to the disease and repeated after 5 days. Acute immunization DPT, combined vaccine for diphtheria, pertussis and tetanus. History of convulsions prior to vaccine or following vaccine is a contraindication. That is all about the whooping cough, and in the next video I will discuss about some other disease. Thank you.